Venous reflux studies, patient is required to stand on a platform which is very comfortable for both the patient and the operator. Patient is asked to stand on the leg which is not being examined. The other one is slightly bent at the knee and rotated externally. The examiner sits right in front, holding the probe in the right hand.
Okay.
For transducer selection, you press the examination button on the console, and you will have all the probes available on the screen. What you do is, for venous reflux, you select linear probe and lower extremity vein. Press the set button. It will connect the transducer to the machine and is ready to go. Once you've selected the probe, put gel on it, a nice good strip of gel on it. Once you got the gel on it, place one hand behind the knee, second one with the probe on the medial aspects of the leg. Locate the long saphenous vein in transverse section. Once you have located, you can either move up or down or turn your transducer longitudinally to take the measurements. Okay, what you do is you put your transducer in cross section and locate the long saphenous vein in cross section. You play with the buttons so that you can optimize the image quality. You can increase or decrease the depth as necessary. Ideally, your image should be in the center of your screen. Your brightness button is located on the right hand side. You can turn it up and down so that the vessel is clearly visualized onto the screen. There it is, you can see it very clearly. Once you have located it, you turn your probe longitudinally. Adjust your control using the brightness and also your TCG. Because it's not running. Once you're in B mode, you can adjust your brightness so that image is clearly visible. Move up towards the sphenofemoral junction, increasing your depth because as it goes up, it dives deeper. Now, as you can see on the screen, it merges with the femoral vein here. Now, femoral vein is in longitudinal plane, whereas saphenous vein is in cross section. Now what we're going to do here, we're going to turn the probe round into longitudinal plane so we can get the long saphenous vein. Now here you can see the long saphenous vein coming around the corner. It's a nice bend here. Usually there is a valve here which gives rise to a reflux in this vein, so it's very important to take a reading as close to the junction, usually about 1 centimeter away from the junction. Now the long saphenous vein is relatively superficial to the deep vein. I'm going to decrease the depth, so get rid of the deep system. All we have is long saphenous vein and the sort of area going towards the junction. Now we're going to scan the vessel along in longitudinal plane. At this point, you can stop and take a Doppler signal to see whether there is a reflux or not. Once you have your vessel in view on the screen, you can see all these speckles passed through the vessel. Next thing we're going to do is put the color on. Now that's your color box, and it needs to be angled correctly at 45 to 60 degree. As you can see, there's too much color bleed, so we need to change the color setting, turn the color gain. So that you have minimum bleed into the surrounding area. Right, we are on the long saphenous vein near the junction in longitudinal plane. As you can see very clearly the vessel here. The common practice is to grab hold of the calf muscle and give it a good squeeze. The idea behind that is you will expand all the venous blood in the calf muscle. It will go up into the vessel. If there is a reflux, you will see blood flowing in the opposite direction. The color flow on these machines indicate directional flow. Red goes one way and blue goes the other way. If there's a reflux, you will see both colors. If there's no reflux, there will be only one color. Right, now what we're going to do is we're going to squeeze the calf muscle and see. So you saw a red color followed by blue color indicating reflux. So we're going to give it another go. Red and followed by blue. So presence of two colors, one after the other, indicates significant reflux in these vessels. There you go, once again, red and blue. The next thing, after you have ascertained that there is reflux, you need to see how long the reflux lasts, so get some objective measurements. For this one, you put the switch on the Doppler pulse wave, and you see this continuous flow. Right, we're going to give the calf muscle a good squeeze and look at the reflux.
We could do it again. Okay.
Right, one more try, good squeeze.
It's freezing.
Right. As you can see here, this the downward trace is the blood going up into the long saphenous vein. Once we release the pressure on the calf muscle, there's a flow back down the leg, indicating quite significant reflux.
It's enough.